Azithromycin is a type of antibiotic called a macrolide. It is used to treat certain infections, including genital infections. It works by stopping the growth of bacteria. However, it will not work for viral infections like the common cold or flu. It's important to only use this medication when it's necessary, as unnecessary use or misuse can make it less effective. It's also important to note that this form of azithromycin is not intended for use by children. The recommended daily dosage and optimal timing for taking this medication should be discussed with your healthcare provider. To use azithromycin packet macrolide antibiotics, simply take it by mouth with or without food. However, taking it with food can help reduce stomach upset. Mix the contents of one packet in 2 ounces, 60 milliliters, of water and drink it right away. Then add another 2 ounces of water, mix it, and drink the entire amount. It's important to note that antacids containing aluminum or magnesium may decrease the absorption of azithromycin if taken at the same time. If you take an antacid that contains aluminum or magnesium, wait at least 2 hours before or after taking azithromycin. Remember to tell your doctor if your condition lasts or gets worse while taking this medication. If you experience stomach upset, diarrhea/loose stools, nausea, vomiting, or abdominal pain, it's important to notify your doctor or pharmacist. Additionally, it's important to be aware that while many people using this medication do not have serious side effects, it's crucial to contact your doctor right away if you experience any hearing changes, eye problems, difficulty speaking/swallowing, muscle weakness, signs of liver problems, fast/irregular heartbeat, severe dizziness, or fainting. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. It's important to seek medical attention if you develop diarrhea that doesn't stop, abdominal or stomach pain/cramping, or blood/mucus in your stool. Prolonged or repeated use of this medication may result in oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. If you experience a serious allergic reaction to this drug, such as fever, new or worsening lymph node swelling, rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. It's important to continue to watch for any of these symptoms for several days after your last dose, as an allergic reaction to this medication may return even if you stop the drug. Remember, this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. Before taking azithromycin, it's important to let your doctor or pharmacist know if you are allergic to it, to other antibiotics, or if you have any other allergies. This is because the product may contain inactive ingredients that can cause allergic reactions or other problems. It's also important to inform your doctor or pharmacist about your medical history, especially if you have liver disease, kidney disease, or a certain muscle disease called myasthenia gravis. Azithromycin may affect the heart rhythm, causing QT prolongation, which can rarely lead to serious fast or irregular heartbeat, dizziness, or fainting. The risk of QT prolongation may be increased if you have certain medical conditions or are taking other drugs that may cause QT prolongation. Low levels of potassium or magnesium in the blood may also increase the risk of QT prolongation, especially if you use certain drugs or have conditions such as severe sweating, diarrhea, or vomiting. It's important to talk to your doctor about using azithromycin safely. It's also necessary to let your healthcare professional know that you are using azithromycin before having any immunizations or vaccinations, as it may cause live bacterial vaccines to not work well. Before having surgery, it's important to inform your doctor or dentist about all the products you use. Older adults may be more sensitive to the side effects of this drug, especially QT prolongation. During pregnancy, this medication should only be used when clearly needed, and it passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of how azithromycin may interact with other drugs and affect your health. Make sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not change your dosage or stop taking any medication without consulting your doctor. Azithromycin may also affect the heart rhythm, so it's important to discuss this with your healthcare provider, especially if you are taking medications such as amiodarone, chloroquine, or sotalol. Always follow your doctor's recommendations and ask about any concerns you may have regarding drug interactions. If someone has taken too much azithromycin and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center. It's important to act quickly in these situations to ensure the person gets the help they need. This medication should not be shared with others. Azithromycin is used to treat a wide variety of bacterial infections. It is a macrolide-type antibiotic. It works by stopping the growth of bacteria. This medication will not work for viral infections, such as common cold, flu. Unnecessary use or misuse of any antibiotic can lead to its decreased effectiveness. Take this medication by mouth as directed by your doctor, usually once daily with or without food. You may take this medication with food if stomach upset occurs. The dosage is based on your medical condition and response to treatment. If you are giving the suspension, shake the bottle well before each dose. Take this medication at least 1 hour before or 2 hours after meals. Make sure to store azithromycin packet macrolide antibiotics at room temperature, away from light and moisture. Keep it out of the bathroom and away from children and pets. Do not flush this medication down the toilet or pour it into a drain unless your healthcare provider instructs you to do so. When the medication is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.